Chapter 18a Autism Spectrum Disorders. Autism spectrum disorders include autism, Asperger's syndrome, and pervasive developmental disorder not otherwise specified. The general characteristics of autism spectrum disorders or neurodevelopmental disorders. These include poor social skills, unusual behaviors, and impaired communication skills. Symptoms of autism spectrum disorders begin in early childhood, however they last a lifetime. Autism spectrum disorders may be associated with other medical conditions, and it's 4 times more likely to occur in males than in females. The Center for Disease Control estimates that 1 in 110 children in the United States have an autism spectrum disorder. Estimates of prevalence have increased in recent decades. It's unclear if this is because it's the true increase in the number of cases of autism spectrum disorders, or if it's due to an increased awareness and recognition, or because there's improved and expanded diagnostic criteria that has allowed identification for autism spectrum disorders. The history is that autism was first described as a disorder in 1943 by Leo Kanner. Hans Asperger first described Asperger's syndrome in 1944. His work was first published in German but did not reach the English-speaking audiences until 1980, when a psychiatrist who was also a mother of an autistic child highlighted his work. Pervasive developmental disorders not otherwise specified was defined in 1987. Severe communication impairment and social skills or stereotype behavior, but do not meet the full criteria for autism or Asperger's. The Diagnostic and Statistical Manual of Mental Disorders, or the DSM, is the handbook used by psychiatrists and psychologists to classify mental diseases. It's published and regularly updated by the American Psychiatric Association. Symptoms of autism spectrum disorders are marked deficits in communication, poor social skills, and performance of unusual and repetitive motor patterns. Within autism, Asperger's syndrome, and pervasive developmental disorder not otherwise specified, there is tremendous variation in the presence and intensity of the symptoms. In the top photograph, this individual is exhibiting failure to make eye contact, social withdrawal within the middle image, and repetitive behavior such as continually touching the ears in the lower image. There's considerable overlap in the diagnostic criteria for autism and Asperger's syndrome, with some differences. Some with autism are intellectually challenged, while some with Asperger's syndrome are intellectually gifted. Some with autism never speak, while some with Asperger's syndrome will speak at length about a particular subject. Some diagnostic criteria differ. For autism, clinically significant delay in language or no speech at all. It's estimated that approximately 40% do not speak at all, while another 25% use some words and then lose between 15 and 24 months of age. Asperger's syndrome does not appear to be any clinical delay in language or cognitive development, and may speak at length about their favorite topics. And this table can be found in your textbook, which breaks down different diagnostic criteria and symptoms between autism and Asperger's syndrome. Verbal communication, as previously mentioned, 40% do not speak at all, 25% speak some words and then lose them between approximately a year and a half to 2 years of age. Some exhibit delays in speaking, and some develop speech at the appropriate time but speak with impaired use of language and poor social skills, such as they may interrupt or use an odd tone of voice. Nonverbal communication, using and understanding nonverbal communication is problematic. Facial expression is disconnected from the words. They may smile when frightened. Limited or no eye contact. Some have no eye contact while others stand too close to the person they're speaking to. And this leads to poor understanding of body language of others. Social skills include impairments in communication is often associated with impairments in social skills. They have trouble listening and engaging in a give and take communication. Inability to imitate the actions of others, a major disadvantage, because this is how young children learn to speak and act in social situations. Some may just say whatever comes to their mind. Inability to cope with change, may collapse in a prolonged tantrum when a daily routine is changed. Other behavioral conditions frequently found in children with autism spectrum disorders include being very impulsive, hyperactive, possibly aggressive, some with self-injurious behavior, atypical responses to sensory stimuli such as touch, pain, smell, sound, may overreact or underreact to these. Motor patterns, the repetitive movements or self-stimulating activities, rocking, head banging, hand flapping, touching the ears, unusual rituals such as touching objects in succession several times before leaving the house. Also all-consuming interests such as fixated on certain topics. Timing of symptom development. Underlying neurological defects are thought to occur early in embryonic development. These are between the weeks of week 3 through week 8 of development, when the central nervous system is developing. Symptoms usually become apparent in the first few years after birth. 30 to 50% of parents notice problems within the first year, and 80 to 90% of parents notice problems by the age of 2. Asperger's may be noticed later than autism because there are no significantly overall delays in the speech and cognitive development in Asperger's. The diagnostic criteria have changed several times in recent decades, which have been reflected in the editions of the Diagnostic Statistical Manual. In 1980, autism was formally differentiated from schizophrenia as a developmental disorder rather than a psychiatric one. Routine development screening of infants and young children occurs at periodic physical examinations. Physicians interact with the child to observe their speech, reactions, and movements. Failure to meet age-specific developmental milestones may entail to further screening. Several diagnostic checklists and rating scales have been developed for diagnosing autism spectrum disorders. Identifying developmental delays early is important because early diagnosis can also lead to early intervention for the child. By age 1, a milestone by the end of the first year is the ability to pull up to a standing position. In the middle photograph, motor skills to build towers or blocks are usually attained after about the first year. The last photograph to the right, Social skills include independence and also defiance. This is a table that can be found in your textbook showing these developmental milestones for communication, social, and motor skills that you may review. Possible causes and theories behind autism spectrum disorders is that autism is caused by aberrant parenting, which is just a cold, uncaring parent. However, autism is not linked to any specific parenting style. This was the refrigerator mother hypothesis that was dispelled in the early 60s. Vaccinations have been a theory of possible causes behind autism, and also that autism is a neurodevelopment disorder that possibly has a genetic basis, probably resulting from multiple causes, possibly that genes and both environment play a role. Neuroimaging studies indicate that differences in brain growth and organization. Different cognitive strategies are used. These individuals may process information in different brain areas. Under activation in part of the brain is involved in facial recognition. Reliable markers, however, have not been identified for this genetic link. Two main types of studies that autism has a strong genetic component include family studies and twin studies. Family studies has found that there's a higher than expected rate of autism among family members. Rate of reoccurrence of autism in siblings of autistic individuals is between 2 to 6%. This is 10 to 60 times that of the general population or general society. Twin studies have looked at monozygotic twins, which are nearly genetically identical. If one of the monozygotic twin has autism, there's a 75% chance that the other twin also will have autism. Dizygotic twins, they're no more genetically similar than siblings. These were dizygotic would have been two separate eggs fertilized by different sperm. Studies indicate that if one dizygotic twin has autism, there's a 3% chance that the other twin will also have autism. This indicates a genetic basis due to the discrepancy between a 75% chance between monozygotic twins and a 3% chance between dizygotic twins. Environmental risk factors include prenatal exposure to certain drugs such as thalidomide. Thalidomide was a drug used for anti-nausea. Maternal illness such as rubella during pregnancy, or drugs used to induce ovulation during infertility treatments. Recent studies indicate that there is a link and an association with the treatment of duration. There's no cure for autism spectrum disorders, and there's no single therapeutic drug known to improve the core symptoms. Oxytocin, the hormone produced by females, is currently being tested. Oxytocin was the hormone that induces uterine contraction and mammary gland ejection. Study in adults in 2010 showed that oxytocin delivered in nasal spray were more likely these children were more likely to focus on the eyes when when viewing pictures of human faces. So that is one, oxytocin hormone is one drug or one hormone that's being tested as a possible drug. Educational interventions also can help children to reach their full potential. Individual educational plans. These may include occupational therapy, speech therapy, or sensory integration therapy. The bottom left shows a young autistic boy using pictures to communicate with his teacher. This was part of his individual educational plan. And these are just, on the right is just a sample of cards used in a picture exchange. Vaccines prevent potentially deadly diseases such as measles, rubella, polio, mumps. Immunization programs have reduced or eradicated serious infectious diseases and saved numerous lives. There was concerns about the possible link between certain vaccines and autism. The measles, mumps, rubella vaccine. It did contain thimerosal, which was used from the 1930s until the early 2000s. Thimerosal is a mercury-containing compound used to prevent growth of microorganisms in certain vaccines. Thimerosal reduced or was eliminated from vaccines as a precautionary measure. In 2004, the Institute of Medicine said was plausible for mercury accumulation in the vaccine series to exceed the federal safety standards. The initial study for the measles, mumps, rubella vaccine linked to autism came from a study in 1998 of 12 children who had autism and also irritable bowel syndrome, in which the measles virus infections the intestines. Live virus results. The live virus resulted in measles infections and the damaged bowels. Theory was that the bowels allowed certain peptides, normally broken down, to enter the bloodstream, which traveled to the brain and damaged. 10 of these authors later retracted their study with the measles, mumps, rubella vaccine. Current scientific evidence does not support this causal link between the measles, mumps, rubella vaccine and autism. Survey shows that 54% of parents, though, still believe autism and immunizations are linked. Public health agencies and the American Academy of Pediatrics in 1999 agreed to reduce or eliminate the thimerosal in vaccines. Vaccines recommended for children under the age of 6 do not contain thimerosal, except there are minute trace amounts in flu vaccines. The vaccines for adults and children 7 years of age are increasingly available in thimerosal-free